Okay, so this is the head and neck exam. I already explained what I'm doing, introduced myself, and washed my hands. So first I'm going to start with the head. I'm looking at her face for any lesions or abnormalities there. And then I'm looking at her hair, any signs of like alopecia or hair loss. And I'm going to feel her hair, feel the texture, and divide in a couple areas and look at her scalp. That looks good. Next thing I'm going to do is I'm just going to feel your head and palpate it and let me know if you have any tenderness, okay? Alright, and I'm checking for any step off or any kind of bumps or anything like that. Any tenderness there? No? Okay, I'm going to move down and feel your temporal pulses on both sides. And I feel +2 on both sides. And then next thing I'm going to do, I'm going to feel her sinuses. So let me know if you have any tenderness. First, I'm going to press up underneath your eyebrows and palpate your maxillary sinuses. Any tenderness there?
Nope.
Yeah, get a little closer. Good. And I'm going to tap and tap. Any pain there? Maxillary? Any pain? And I'm going to tap. Any pain?
No.
Okay, another side. Good. All right, now I'm gonna check out her TMJ. So can you open your mouth for me? Close, open, close, and now do it again. Can you go a little wider for me? All right, good. And bite down for me. I'm feeling her parotid gland, and it feels good. And I'm gonna check the rest of her glands now. Submandibular, and then I'm gonna do sublingual. Can you open your mouth? I'm just gonna kind of pinch like this. Relax for me. There you go. And other side. And good. You okay? Okay, and then next thing that I'm gonna do is the neck exam. So first I'm just looking at her neck and her trachea and making sure that everything's midline. Can you kind of tilt your head back for me? And good. And I'm looking at her neck with tangential lighting as well. And that looks good. And then I'm going to try to feel for her thyroid gland. Can you kind of relax your neck like that for me? I'm feeling down. And then I'm feeling right here. And can you swallow for me? Okay, good. And do you mind standing up now? So I'm going to feel the back of her neck here, feel down her spinous processes, and let me know if you feel any tenderness there at all. Anything? No?
Good.
Any tenderness there? No? All right, look at me now. Now I'm just going to test your range of motion. So can you look down for me? Back, side, other side, and can you twist your head like this? And the other side. Okay, good. You can sit back down. Okay, and then the next thing I'm going to do is check her lymph nodes. So I'm just going to kind of use 2 fingers in a circular motion, see if they're hard or if I can even palpate any of them. So first I'm going to start with your occipital, posterior auricular behind the ears, and then preauricular. Then I'm doing the submandibular and the submental. That's good. And then I'm going to move on to her anterior cervical on both sides. And your posterior cervical as well. Down the sternocleidomastoid mastoid. And then I'm going to do your tonsillar as well. Okay, and then I'm going to feel for her deep cervical as well. So I'm going to find the sternocleidomastoid right here, and then I'm going to have you turn to your left. Feeling down for any nodules. And the other side. Can you look it straight at me first? All right, good. Now look. There you go. And then the last one I want to feel is her supraclavicular. Looking at my fingers and going across. And it feels good to me. Thank you.